On the one-year anniversary of the World Health Organization officially declaring the COVID-19 a pandemic, 11% of Wisconsinites are fully vaccinated. Almost 1 in 5 have received at least one dose of the shot. And more good news, another 2 million people will soon be eligible for the COVID-19 vaccine in Wisconsin. So did you make the cut?
The state health department announced 20 health conditions that will qualify people for a vaccine starting March 29th.
And Naomi Coles explains. Naomi?
Sidestepping other factors like essential jobs, one of the biggest factors that's going to open up eligibility for one of the largest groups yet is a simple calculation: your BMI. Asthma, cancer, type 1 and 2 diabetes, liver disease. All those and more will qualify you for the COVID-19 vaccine in Wisconsin starting March 29th.
It is based on the best evidence we have about which medical conditions make someone more vulnerable to severe illness or death.
But one metric alone that could include almost 70% of Wisconsin, a BMI of 25 or higher. In total, the newly eligible group is more than 2 million people. It could be closer to 3, but ultimately it's hard to tell exactly.
Of the total people in this group that would be eligible, a whole bunch of them are already done.
You won't need to prove your condition no matter where you get a vaccine, but health providers may prioritize based on risk when reaching out for scheduling.
But DHS is not mandating or requiring that any sub-prioritization happen. Everyone who is eligible under this group by virtue of having any of these conditions is now eligible.
Earlier today, a public health representative said Dane County would be ready to roll through its share of people.
If the supply is there, we have the capacity to be able to go through this group fairly quickly.
And if you still don't qualify, well, you'll have to wait. The state is not opening up categories for other essential workers, but expects to open vaccines to the rest of the general public sometime in May.
And if you're lucky enough not to have one of these health conditions, you will be lucky enough to be included in May.
State officials don't yet have a set date for when they plan to open up eligibility to everybody in Wisconsin or every adult in Wisconsin in May. They do, however, plan to use a couple factors to determine that. One of those is going to be how many people are already vaccinated in current eligible groups, and then lastly, also how many vaccines they're getting every week from the federal government.
Naomi, thank you.